Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great video for those of you with degenerative, herniated, and bulging discs in the lower back, L1, 2, 3, 4, 5, and S1. We're going to talk about a simple walking exercise to correct rounded shoulder posture that'll help relieve and prevent your lower back symptoms. So out for a great spinal rehab walk here in the Appalachians in early winter, we're going to share with you today a wonderful exercise, simple walking technique to help improve shoulder posture as it relates to lower back disc herniation, bulging disc, and degenerative disc pain. Many people don't realize, but shoulder posture has a lot to do with what creates lower back pain through mechanical forces that repetitively stress the back during the day. One of these that we're going to tackle today is rounded shoulder posture. Normally the shoulder should have a flat contour in the front of it, but when it rounds due to habitual poor posture, it pulls on the latissimus muscle that runs from the shoulder area down to the lower back, and that pulls on the spine, many times aggravating repetitively disc fibers, irritating degenerative, herniated, and bulging discs at L1, 2, 3, 4, 5, and S1. So there are many rehabilitative exercises you can do to help with rounded shoulder posture, but one of the most simple is walking, because we all walk 5,000 to 10,000 steps a day, so it's a great way to use the endurance or repetition of the walking motion to improve this posture and relieve the resultant irritation on the lower back. So what we're going to do is, as we walk, the side that rounds more. Now if you've analyzed yourself and you've seen that both sides round, you need to do this to both sides, but if one side rounds more, you need to emphasize that. We're going to be emphasizing a backwards pull or a pinching of the shoulder blade towards the spine on the side that's rounded. That's going to wake up the weak rhomboid and trapezius muscles on that side and also activate the lat muscle that many times, because it's been rounded, the lat is lengthened and weakened, and that has a pull along the thoracolumbar fascia into your lower back. So we're just going to try to pinch that blade towards the spine a little bit to increase the distance on the front of the chest, to stretch it and tighten or shorten the distance between the shoulder blade and the spine. And I'm going to do that in the walking cycle when the opposite leg goes behind me. As you walk, remember, opposite limbs go behind and forward at the same time. So every time I take a step, let's say my right side is rounded more than my left, I'm going to emphasize pinching my shoulder blade back a little bit more as I take a walk. And that'll look like this as I walk. Just a little more pinch on that side. Over time, that's going to help to undo that rounded shoulder posture. It's going to strengthen the latissimus, the rhomboid, the middle trapezius, and it's going to create a more equal pull from the fibers from the shoulder down to the lower back across that lumbothoracic fascia that irritates many times disc problems. Now with that, keep in mind also you want to think about the opposite side, because the lat, as it comes down through that fascia, attaches to the opposite glute max or buttock muscle. And many times what you're going to find with a rounded shoulder posture is the opposite side buttock that's part of that same, what they call posterior oblique sling in spinal biomechanics, becomes weak. So many times you need to emphasize a contraction of the weak buttock on that opposite side when you're unrounding that shoulder. If you have a multifidus problem, many times it's also on that opposite side. You want to keep in mind your unique neutral spine when you're walking. That's different for each person based on an analysis of your body mechanics. For me, I always want to focus on my left L5 muscle in my lower back, contracting it right next to the spine, and keeping my left hip down as I walk so I don't have a tendency to hike it up. Your unique spinal biomechanics, of course, are going to be custom fitted for you based on an analysis. If you don't know what your spinal biomechanics are or what your repetitive posture and movement and core muscle errors are, check out the painfreeandfit.com website. We have a free body analysis. It'll help you to get started to analyze your mechanics, and you can plug those corrections in to these corrections. Looking for a great way to improve your walking and your mechanics as it relates to back pain and help relieve it? Check out our Walk-Away Back Pain program available at painfreeandfit.com. It has all the walking exercises, analysis to figure out how you should walk differently for your particular lower back problems, stretches, rehabilitative exercises that you can do that support those corrections, and all the documentation and the scientific literature that supports walking and corrective specialized spinal rehab exercises to help relieve chronic degenerative, herniated, and bulging discs. I hope this tutorial on walking and rounded shoulder posture helps you with your chronic lower back disc problems.